Hello. The process of developing a universal FUE donor classification system began about 15 years ago when I noticed certain variations and trends when observing transaction rates in any given individual. I found that in the same individual, with me being the same operator, using the same technique, same technology, we were registering transaction rates that varied from one area to the other. That was quite significant. Also, when doing Afro patients that were then considered to be universally difficult to perform, I noticed that some patients that have the curliest hair, FUE was very easy in them and the transaction rate was very low. On the other hand, we had Afro patients whose hair curliness was very mild, and yet we will have a very tough time using the same technology and the same technique with high transaction rates. 2 years later, I decided to start collecting transected grafts from my patients. We'll collect transaction grafts for histological analysis, grafts that were from areas of high transaction rates were compared histologically with grafts taken from areas of low transaction rates in the same individual. We did that about 12 years ago, and a trend emerged very clearly. The first thing we noticed in histology, comparing the hard or high transaction rate zones to the low transaction rate zones, was that the high transaction rate zone grafts manifested a very compact epidermis compared to the other. Compact in the sense that the stratum corneum, the very top layer of the skin, was very dense. The cells were densely packed, which correlates with a tough, slippery skin. In FUE, in the parlance of FUE, that means the punch will not penetrate as easily as it will the other type of graft. Rather, there is a tendency for it to kind of slip on the skin or bounce off the skin rather than penetrate it, which we know will contribute to the dynamics of FUE. Furthermore, we noticed that the grafts that came from the very difficult areas with high transaction rate had a denser, thicker dermis, which also means that the punch has more difficulty penetrating all through to separate the graft. This led to the conclusion or the conviction at that time that what contributes to FUE difficulty is not just a matter of the curliness of the hair, but that the skin characteristic, the epidermis, the dermis, is a major player in the process. Now, the curliness and skin texture of any individual evolved as a response or adaptive measure to the geographic niche in which that person evolved, mainly to adapt that person to temperature and UV exposure rates. So, by evolution, we expect that an individual that evolved in a very sunny, hot area will have curlier hair and the skin will be thicker. Conversely, you expect somebody who evolved in a very cold, less sunny area to have straighter hair and the skin to be less thick. That's what you expect, right? No. Why? Because of the migratory nature of the human species and the admixing of genes that occurs in the process or along the way for millennia. That expectation was made complex. So what you'll find is any given individual today will have a hair type that is stereotypical of a hair that evolved in a particular part of the world based on the sun and temperature changes there, only to have a skin type that is reflective of somebody that evolved in a very different part of the world with different inclement weather. So what we have today in every given individual is a potpourri of possibility combinations of skin type, hair type that no longer reflects what you would expect for particular geographic or ethnic niches. The Sanusi FUE scoring scale accounts for this complexity. How is it used? I present to you a video that explains how to use this scoring scale. Thank you.
My name is Sanusi Umar, the lead author in our paper titled Universal Follicular Unit Excision Classification System for Hair Transplantation Difficulty and Patient Outcome. We present a new FUE difficulty level predictor called the Sanusi FUE scoring scale that is based on FUE donor characteristics of hair and skin type. Hair type is classified or broadly grouped into three subgroups. First subgroup is the straight to wavy hair type, which presents the least difficulty to FUE. Second group is the curly hair type, which presents moderate difficulty to FUE. And the last hair type is the coily or tightly curled hair, which presents the most difficulty in FUE. In regards to the skin donor character, there are three subgroups as well. Number one is the thick firm skin type, which presents the most difficulty to FUE. Soft to thin skin type, which presents some difficulty to FUE, and the average or medium thickness firmness skin type, which presents the least difficulty to FUE. The practitioner begins by assigning scores to the hair type and the skin type of the patient presented. The scores derived for the hair type is tallied and added to the scores assigned to the skin type. The total score is used to determine the SFS score of the patient. The score that will be derived will range from 2 to 9, and this will fall into one of the 5 SFS grades. Class 1 is a total score of 2 to 3, which connotes no difficulty to FUE with low graft attrition rate expected. Class 2 is a total score of 4, which presents low to moderate difficulty to FUE with low to moderate graft attrition. Class 3 is a total score of 5 to 6, which presents moderate difficulty to FUE. This type of patient susceptible to decapit of the graft. A total score of 7 to 8 connotes class 4, which is moderate to high difficulty FUE, and moderate to high graft attrition rate can be expected. Total score of 9 is class 5, which connotes high difficulty with expectations for very high graft attrition rate unless extra skill sets are adopted or specialized equipment are used. In summary, we presented a new FUE difficulty scoring scale called the SFS scoring scale that is expected to predict FUE difficulty and also influence patient outcome.